Welcome to Dr. O Solutions. My name is Oleg Nikishin. I am the founder of Dr. O Solutions, and in this video I would like to present you Ozone Enema Kit. We developed this kit for specific reason. Many of you called us and requested references for blood ozonation, direct blood ozonation. Now, however, many of you cannot find local practitioner. So I was forced to find a different alternative to the blood ozonation. And I know many of you buy rectal and vaginal ozonation kit, and it is very powerful therapeutic remedy, ozone, rectal and vaginal ozonation. But I would like to present you Enema Kit as alternative to it, number one, and second, as a therapy that has much deeper effect, healing effect on your body. So how does it actually work, and how this Enema Kit in ozone enema as a whole therapy is different as direct ozone insufflation. When you do insufflation, you insufflate ozone oxygen volume mixture to your rectum or to your, for instance, as a vaginal kit, as vagina. Now, ozone will start deteriorating very rapidly. Your colon lining will oxidize, will neutralize, ozone, and it will lose its potency within the 15 minutes. So it does provoke the healing as your ozone through enzymatic reaction will go in through the colon lining and go to the blood and will start working way up. The Enema Kit works a little bit differently. Now you ozonate enema and ozone stays in the water. Ozone stays in the water in the room temperature for almost 24 hours. Ozone in the water is not as rapidly reacts with any, so to speak, the substance that get in contact with it. So when you do ozone enema, or you ozonate the water, and you do enema with it, as you know, what colon does is it squeezes the substance inside it, and whatever inside the colon, but the first primary function of the colon is to squeeze the water out of your content. So the ozonated water will go right through the colon, through its lining, it will go to the blood. And because ozone stays much longer and less potent in the ozonated air, it will go in the blood and ozonate your blood. But your blood will not react rapidly with it. So the healing reaction, much deeper reaction when you do ozonated water through the colon. So you have much deeper tissue regeneration, and will bring up a lot of healing reactions as well. So that's why we know for a fact from many of our feedback from you, my friends and the customers, how powerful is ozone enema is in the terms of therapeutic values. And let me show you just what it contains. So as you can see, it comes with a jar. It's a quite large jar, and it has the volume settings go up to 2.5 liters or 12 cups of water. Okay. Inside you see silicone tubing with a stone. It has a output port, which is male lure connector to it. It comes with 3 catheters, just like that, with the lure connector on it. It comes with a 1 meter extension, lure connector on it as well, male and female. It comes with connecting tubing from generator right to the enema. And optional, if you would like to have if you don't like this ozone smell, or you use it in a very tight and small room, you probably will need to destruct ozone. So the optional destructor is optional. One thing it comes with as well is a blind cup. So that's a cup, stays in the port and blocks the port output. And I later explain you why do we supply it. Okay, now let me explain you how you do the ozonation. But first, let me tell you, before you proceed, for instance, you're excited, you want to do it, and you know it's going to work for you, because ozone works 100% of the time. It does differently with everybody, but it does work. So, for instance, you never done colon enema, you never done colonic, you never done colon flush, in other words, you need to clean your colon. Don't jump in right in the ozonation. I strongly recommend you do the cleansing enema first. When you do cleansing enema, not only once, you do cleansing enema quite a few times. For instance, again, if you know your colon is toxic, for instance, toxic colon will show itself as many skin disorders, as psoriasis, as eczema, as many different toxicity on the skin. For instance, it could be even rosacea, sometimes it presents itself. So all those skin condition most of the time it's a tell sign of the toxic colon. So if you do have one of those, or your practitioner recommend you colon cleansing, don't jump in right in ozone enema. So as I said, you need to do colon flush. I would recommend maybe 3, 4, 5 times. And you do that till you have that lining. You will set that mucosal lining when you go on the toilet after enema. You will have that mucosal lining expelled from you. You will see the toilet, and that lining is laying there. So it's one time, or second time, or third time, and you see still that mucosal lining coming out. At this point, that means your colon is shelling its internal hard lining. Don't jump in the ozone enema. Continue to do your enema flushes. Sometimes people say that they have even calcium deposit they can see in the toilet. Yes, it is possible that your colon has a hard calcium deposits in it. If you see that, that means it's a very good sign. So your colon is getting much cleaner. So continue to do that colon, that enema flush till your colon is completely clean. And you're going to feel differently. After that, if you would like to do coffee enema, it's fine, absolutely, I recommend it strongly. And you know, many clinics do use coffee enema, so it has to be organic enema, organic coffee, sorry. How you do the coffee enema? You just take two tablespoons of organic coffee and you boil it for 15 minutes on a very low temperature. Then you filter it, and that usually takes about 1.5 liters enema in order to do the procedure. So you do the enema for a certain period of time, and now you are sure your colon is ready for your enema. And now I'll show you how you do the enema preparations. Now, you take distilled water and bring it to the room temperature. Don't do the cold, even though I know ozone absorbs much better, and you bring more high concentration of dissolve ozone in the cold water, but don't do cold enema because you're gonna lose that temperature in the colon and you might gonna catch a cold. So I would recommend to do the room temperature or even a little bit even higher temperature, something like maybe 28 by Celsius. Again, I specifically say by Celsius because in medical field, not the temperature measured in Celsius. So you put the warm water, and I would say 1.5 to 2 liters more. You have to attach extension because this port is open. You do put the extension to it, and extension comes with a thumb lock. So you just simply lock it. Connect your silicone tubing directly from your ozone generator to blue lure port. You have to, white is output, blue is input. Okay, set your ozone or your oxygen feed to, I recommend 1.8 liter per minute. It's a perfect feed. It's not it's not too fast and it's not too slow. Turn your generator on and let it ozonate the water for about 10 to 15 minutes. So in order to get up to 2 ppms of dissolved ozone in the water at 1.5 liter volume, it will take about, in white, 8 liter per minute. It will take about 30 minutes. Again, that's optimal, and 2 ppms is quite high concentration. If you've never done it before, the ozone enema, I would recommend start slowly, as we do always. And by the way, it comes with a manual, the kit. Its instructions, and it's very simple to read. Always start with ozone, always start slowly. Never jump right into it. Never start putting a lot of ozone to your body. You need to kind of build up that enzymatic reaction in you. So you start very slowly. Try to build up that enzymatic reaction, and you will feel it. You will feel healing crisis. You will start feeling much better. And one other word of caution: if you clean your colon for instance a week, and you know your colon lining is clean, again, don't jump in without doing that. That's extremely important. Even though if you do just rectal insufflation, I repeat it in our video, says never do it without enema and knowing that your colon lining is clean. So you do, for instance, ozonate for 10 minutes, that's how I recommend, and do the colon enema. But how you do the colon enema? So you have 1.5 to 2 liters water, so use distilled water, and we know it's ozonated. So what we do is we put about 1 cup of that water in your sigmoid colon. This is right from the beginning of your colon, and you hold it for about 5 minutes. Then go to the toilet and empty your colon. So empty your bowel. You have a bowel movement. That will open up your sigmoid colon, and next portion of the water will go right deep to it. When you do that, lay down flat on the floor, get the yoga mat, put it under your butt, so you have this kind of position. When you do the enema, it just goes and goes much deeper, and water flows in transverse colon and descendant colon. So, and just take it slowly. By the way, the enema, the tubing and catheter, that by the way is directly connects to it, it has very tiny openings. That means the water will start going very slowly to your colon. If you feel like the that water is not going in because you raise this door up, for instance, in your sink, and you see the water stays in. So that means you have output blockage, or you have a blockage in the colon. Still do have a blockage in the colon, you have a fecal mass there. So again, you have to do it, empty out again, and try to let that water go into your colon. And for that specific reason, we supply that cup. So what it does, for instance, your cap of output, that means there is no ozone output. In ozone, will start building up the pressure in it. So for that reason, you have to have all this set up in your bathroom. So that means you're still ozonating, and this is still in your colon. And you have building up slowly pressure in it, and you're going to have more water coming in through the tubing and through the catheter into you. That's why we supply this cup. Again, so you, assuming, so you want to do, you did that half a cup or cup, empty your bowel, and you want to do maybe half a liter or even a liter. I do myself 1.5 liters because I've been doing it for many years, and I'm okay with it. But from the beginning, you're probably gonna have some colon spasm. So because the function of the colon to squeeze whatever comes through the small intestine, and what you do when you put the water, you're expanding it. So natural reaction of your body will squeeze back, and you're gonna have some spasmodic reaction. You're gonna have some cramping. So at that point, it's okay. You gotta get up and go on the toilet. So till you feel like your colon is already adapting to the water. So not try to put all that 2 liters or 1.5 liters right into you. It's very hard. So again, get used to it. And you're gonna have probably a few accidents. It's totally fine. Put the towel. I will usually lay out the black towel in the floor, and this is perfectly fine. Don't worry about it. So now, for instance, you did an animal once. You ozonate 10 minutes, that's what I said from the beginning. So it's a good low ppm, for instance, half ppm or 1 ppm in the water. From the beginning, it's still okay. And you do that animal, and wait till you'll see the reaction of that animal in you. Sometimes it takes day, 2 or 3 days to feel it, and all of a sudden you have some pain in the recovery pain. That means that's a good healing pain in your body. So don't jump into the next animal. Wait till that reaction passes. That means your body recover and you're ready for the next stage. So I know, for instance, the cancer patients, they call us, they want to jump right in, they want to do a lot, they want to do fast, they do express. Again, and this cancer condition do not develop overnight. This is very long progress disease. So adapt yourself to the new regimen, adapt yourself to the new condition, and work on it. I always recommend find a good practitioner, good well-known practitioner who knows your biochemistry. I always tell and train the doctors, before you do ozone treatment, get the biochemistry, know your blood test, to see how ozone changes your blood biochemistry. Don't assume anything. Just monitor all the results. So especially if you're a cancer patient, please, it's extremely important to find good, knowledgeable practitioner who can guide you through, because you're going to have many different symptoms, and the symptoms is very confusing for you, because you're going to have many different pains, and you don't know how to determine what pain is good, what pain is bad, what's going on. If your practitioner is a doctor or whatever you trust, let's call them trust practitioner. It could be the doctor, it could be naturopath, it could be ozone practitioner, whatever it is. So if he knows your condition, he will be able to guide you through that rough waters till you will get very familiar with your body and what ozone does to you. So that's most important message I want to relay to you. Always start slowly and establish the baseline. on your body biochemistry, know your blood tests, know what you're dealing with, and then move slowly. Okay, again, we have Ozone Research Group on the Facebook. Please engage, please give us your feedback. If you like our video, give us thumbs up, share this video, ask questions. Please engage, don't sit on the sideline, and share your experience with us and share your experience on the Facebook with other fellow practitioners, or even your other customers who wants to know what's happening in ozone research field. So that's all, folks. See you in the next video.